One of the most common injuries to the knee involves a tear of the meniscus, which is a shock absorber inside the knee joint. You can also tear major ligaments inside the knee, including the anterior cruciate ligament or the medial collateral ligament. Treatments for sports injuries of the knee can include physical therapy or even surgery. But sometimes the physical therapy needs to be supplemented with other things, such as knee braces that can lessen the risk of certain injuries but also allow certain things to heal. Knee arthroscopy is performed using a special camera. It's about the size of a number 2 pencil. Typically, 2 incisions are made on either side of your patellar tendon and below your kneecap. One hole is used for a camera. The other hole is used for instruments. These 2 holes typically can get you a good look at virtually the entire knee. Most people who are active in sports, especially cutting sports such as skiing, basketball, really need to have an intact anterior cruciate ligament. Undergoing an anterior cruciate ligament reconstructive surgery, which is an arthroscopic assisted procedure, can give you a knee that will be a lot more stable for the sports that you want to do. The rehabilitation process for arthroscopy varies depending on what your diagnosis is. On the more minor end, you may only need to do physical therapy to try to improve your range of motion and ultimately your strength before you can release to full activities. Whereas if you undergo an anterior cruciate ligament reconstruction, the rehabilitation process is much more prolonged and much more protective to allow time for your graft to heal, but at the same time making progress with regards to your motion and your strength and eventually your return to sports. The vast majority of people who have knee arthroscopy surgery can return to their full level of sports. Rarely, you cannot return to full level, full intensity, full speed, but most of the time, people do. Sports injuries to the knee are very common, but if you have pain because of sports, it would be very reasonable for you to talk to your primary care provider or your orthopedic surgeon about that pain. They can help you diagnose that pain and decide the best course of treatment for you. That may involve arthroscopic surgery or it may not. But if you talk to your orthopedic surgeon or your primary care provider, they can help you decide the best course for you.